Mental professionals of Reddit. What is the worst mental condition that you know of? Story 1, Cotard delusion. I'm a nurse and had to take care of a huge man with this condition. He came in with some odd behavior and escalated to Cotard. The delusion makes you think you are actually dead. He would scream he was dead all day and night, lived in constant terror. He was such a sweetheart, but became so worn down and terrified over time, he got quite dangerous and punched a nurse in the face. Nurse. I had a couple patients get ICU delirium that presented with them believing they were dead. Definitely not a fun time. I mean, it sort of makes sense. Being in the ICU can be comparable to torture with the sleep deprivation, constant beeping and other noises, lots of pain and other physical discomfort. The thirst and hunger are very psychological. So even if we give someone nutrition through a feeding tube or IV, your brain still freaks out because you're not eating or drinking. And so for some people, if you wake up, don't know where you are, and you feel like you're being tortured, reasonable enough to assume you're in hell. Story 2. Delusional parasitosis comes to mind with this prompt. I've watched a patient go to well over a dozen doctors trying to get confirmation that they're parasite-ridden. After countless stool samples, blood work, labs, scans, biopsies, etc. She clearly didn't have any, but remains convinced. A friend of my mom's ended up with something like this after getting into the wrong kinds of meds. She was convinced that there were little bugs in her face. Absolutely convinced. She'd pick at her face day and night. Picked her face skin off bit by bit until the sight was horrific. She got clean for a little while, came to her senses, and stopped picking. But the damage was done. Her entire face was scarred. Story 3. Though not a medical professional, during my brief time working at an outpatient facility, I encountered a patient with body integrity identity disorder. Convinced that his arm wasn't his own, he consistently described it as feeling like a stranger's limb. His intense desire to have his arm removed led him into a deep depressive episode that ultimately needed amputation. Post-surgery, he claimed to finally feel a sense of peace. However, I left the job, so I don't know the lasting impact on his mental state from the surgery. Body integrity dysphoria is still a relatively unknown identity disorder and doesn't have many treatment options so far. SSRIs are usually given to alleviate depressive symptoms, but it doesn't always seem to help. Going through something like that just seems like an awful experience. Dealing with those obsessive thoughts nonstop, that's gotta mess with your head big time. Story 4. Schizophrenia, hands down, no contest. 90% disability rate, 30 years shaved off of natural life expectancy. Common comorbidities include both mental health and physical disorders. Some people still think schizophrenia is dissociative identity disorder, which obviously it is not multiple personalities. But a less ignorant yet even more common misconception is that schizophrenia is a monolithic disease. That is, it shares an underlying pathology between cases that causes it. The reality is that schizophrenia is nothing more than a cluster of symptoms, and there are many different pathologies that can lead to those same symptoms. Part of the reason schizophrenia has a reputation for being the be-all and end-all of insanity. You cannot go more crazy than schizophrenia. It does not exist. Schizophrenia is the end of the road for all madness. Story 5. Prosopagnosia. I had a patient with this as a therapist. They reported to the ER because their face fell off. The only thing therapy could accomplish was to teach patients how to use other markers to identify people. Capgras syndrome. The idea that the people around you were replaced with imposters. This one is absolutely hell on everyone. And in neuropsych, definitely primary progressive aphasia. Basically, you aggressively lose the ability to speak and understand language. I had a patient once that was late to their appointment, and when they finally got there, they were pissed because none of the signs were in English. They failed all of their language tests, but passed all the other markers to rule out dementia. This person was an avid runner, vegan, perfectly healthy, and would likely go on to never be able to speak or understand anyone speaking to them within 5 years or so, yet live a long life due to no other health concern. Story 6. I heard about a guy who thought he was on fire the whole time he was awake, so he screamed until he passed out, day after day. How can you even treat that? Ooh, I know a similar story. There was an old guy who did that all the time, exactly as described. No medical professional could figure it out, and nothing helped at all. I'm not sure how they found out, but eventually they found medical records that had been hidden and no one, doctors, etc., could see it. It was hidden because it was a massive mess up. It had occurred years before he started having a bad time. Turns out he went in for heart surgery, and he woke up right as they started cutting into him. So he felt, saw, and heard everything. It ended up being a repressed memory until years down the line he started screaming anytime he woke up and never stopped. There was a Mr. Ballin video on it, I think. If anyone wants the link to the video, I can probably find it. Story 7. Childhood Disintegrative Disorder. Nightmare Fuel of the Highest Order. The child starts to regress in development language, and speech starts deteriorating, lowering acquired motor skills, losing bladder control, progressing until they are vegetative and non communicative. The person that the child was has disintegrated completely. We have no idea what causes it, nor any treatments, no detection of it beforehand. But what turns it into pure nightmare fuel is that there actually is one preceding symptom. The child is utterly gripped by fear and intense feelings of something being very wrong with them, often complaining to the parents that something is terribly wrong with them. Story 8. Some of the rarer dementia. There's one that literally turns a perfectly normal person into a psychopath. All their other faculties remain intact. There are dementias that literally melt your brain and don't even have a name. There are rare familial types of dementia, so specific to certain families that they don't have a name but can develop really early. And again, it's coming your way. And then there's Huntington's, which you likely know you're getting and have seen your loved ones go through it first. The embedded hallucinations in Lewy bodies can go either way, very distressing or comforting. With the non organic illnesses, it's a toss up between treatment resistant psychosis and severe emotionally unstable personality disorder for the impact on quality of life. Story 9. Tidy absurd sheet humor in fearless insurance, abundant flowery growth. It's early in the morning for me and just getting coffee, so probably a dumb question. Narcissistic personality disorder? I'm assuming so from the context, but I've noticed that my understanding of the shortened versions of things is out of date. I've also heard it's the hardest to diagnose and treat, mainly because they have a blindness to what they're doing and don't seek help, but also they don't participate in their treatment. Of course, that's coming from just what I've read about and could be entirely off base. Story 10. I heard anorexia has the highest mortality rate. I had anorexia in my early to mid 20s. The biggest issue for me was that when I lost weight, people would constantly tell me that I looked so good and they were proud of me. If I gained even 1 pound, I would feel like the world's fattest and ugliest failure. I felt like the people who told me that I looked good would be disgusted with me. I would faint constantly and wake up in the middle of the night, unable to catch my breath. Story 11, mental health care trained, ended up in a different field. Manipulative personality trait. They aren't really diagnosable, they can be treatable. But paying for treatment is a nightmare because it's hard to get a proper diagnosis. Manipulative personality disorder isn't a DSMV disorder, but borderline personality is. But borderline doesn't cover actively manipulating family and children so that an adult can have an advantage. Manipulative personalities and behaviors create family environments which are hostile and abusive, but nothing can be done until that happens. It's a gray area, which is why I think it's difficult. Story 12. That's a hard one to answer because everybody is so different, and their experiences of mental illness can be so different. For instance, I've worked with people with chronic schizophrenia with hallucinations so horrendous you can barely imagine, and others who manage the same chronic mental illness with totally different symptoms and a high quality of life. I can definitely think of individuals with particular presentations of mental illnesses I would consider to be the worst I've ever seen. But thankfully, not everyone with those illnesses will have that same experience. Story 13. I'd say the worst has to be schizoaffective disorder. It's basically a combination of both schizophrenia and bipolar depression disorder. Yes, when you aren't having a psychotic episode, you're having a manic episode. Schizophrenia is one of the worst mental disorders, but mixing it with another one? That's hell. I'd say it really depends. I got diagnosed with schizoaffective disease almost 7 years ago. They told me I'd have it for life. After getting out of the psych ward, I stopped hallucinating and never did sober again. For a while, I had something more akin to complex PTSD, and now I have a subclinical version of that. I'm pretty functional, though. What I went through haunts me all the time. Often, mental illness is just crap life syndrome and unprocessed trauma. I'm sure some people have genuine underlying neurological dysfunctions, but way more people have problems of living. If you torture anyone enough, they're liable to have a mental breakdown. Story 14, anything that comes with unshakable paranoia. Schizophrenia's forms of dementia. People are scared all the time with no way out. Attempts to soothe the many worries usually get sucked into a whirlpool of delusions and transformed into another reason to be afraid. Also creepy. A symptom of severe alcohol damage is seeing vermin crawl around, in the easier version on surfaces around the room. In the bad one, they're crawling under the skin. No pink elephants or white mice, rather cockroaches, spiders, or maggots. Again, logical conversations do nothing to fix it, if people are even still able to follow a conversation at all at that point. I'm a recovering, 3 years sober, alcoholic. In my worst states of DT, I 100% saw spiders and spiderweb everywhere. And I could also feel the webs on my skin. It's very, very real in those. And it's like living in an inescapable hell that keeps you awake for nights on end. That's why I relapsed over and over. I'll sometimes still get zaps and feel the feeling of the webs randomly. I don't wish alcoholism on, and I wish people would take it more seriously. Story 15, I have a mental illness and living with it is horrible. If you ask me, they are all horrible for the person living with it. Wanting not to be alive, but knowing you cannot inflict the pain and suffering to family members. Knowing you're here and your family members supporting you is still causing them pain that is hard to deal with. Holding down a job and being a productive human is all time consuming and exhausting. I am grateful to be alive, have support. I understand I will have to be medicated for the rest of my life. Story 16, Huntington's disease. I'm a master's student, and my research work is around HD. It has the symptoms of Alzheimer's, schizophrenia, and Parkinson's combined. Although it affects 1 in 10,000, it is a genetic disorder where even if one of your parents has the mutated gene, you have a 100% chance of getting it. People have gone to extreme lengths of sterilizing their reproductive system in order to stop passing down the gene. It is a progressive disease, and it only gets worse with time. Starts from muscle twitching to involuntary movements, inability to speak, and full muscle paralysis. The symptoms get worse with time. In fact, it gets so much worse at the end that the only relief is death to oneself. Life expectancy is max 30 years after diagnosis. Story 17, not a condition per se. And I bet there are more horrible things, but appearing or being perceived by others as more mentally handicapped than you actually are. Imagine being treated like a small child at all times. No matter what you say or do, your whole life and all familial connections have long since stopped visiting. It's isolating even when around social people, all the time, forever. I had a patient who had regressed to an infant state, and in talking with them and working with them, I got them toilet trained, doing their ADLs, participating in activities, expressing themselves, eating independently, and dancing. They got discharged back to their residence where they were treated like a severely handicapped person. Within 3 weeks, they had regressed back to the infants, 3 months gone in 3 weeks. Be kind to people for no other reason. I'm a psych nurse in a psych hospital in Canada. Story 18. Maybe a basic answer, but as a therapist, severe OCD is the worst I've encountered in real life working in a clinical setting. It's completely indiscriminate of who it affects and has absolutely ruined the lives of some really brilliant and wonderful people that I've worked with. It's also more difficult to treat than you'd suspect. Medications and therapy are pretty effective for many of the more severe and chronic mental illnesses, but OCD can be particularly resistant to any intervention and causes such intense distress. Not at all trying to diminish the impact and difficulty of any other illness, but personally, I think the more severe cases of OCD are terrifying. Story 19, not a medical profession, but cluster B personality disorders. You have a group of people that, untreated, can be narcissistic. They see the world in black and white. They are never at fault. No one understands them. They can be hyperexcited, not always. They can be violent, manipulative, and opposed to authority and order. They usually have other mental illness issues as well, like bipolar, depression, anxiety, etc. I have two cluster B parents. They didn't get diagnosed or helped. I have learned what is happening through my own therapy, and it is basically only good guesses because they won't allow anyone to actually diagnose them. My mom has borderline personality disorder and bipolar 1. She is manipulative, lives in her own version of reality that is a soap opera. There is always drama. No slight is too small to be imagined. She has no friends, overshares, is cruel, and uses the fact she considers herself a victim of my father to use and manipulate everyone around her. There is no low she won't sink to. As an example, she was jealous and mad when my oldest daughter died of trisomy 18. She wanted the funeral services 2 hours away at her church, and she wanted to arrange it. Instead, we had the services by our home and my mill, who's a different kind of BPD, arrange the services for us, but she listened to us and was a help. My mom asked if we could have a mass said in my daughter's memory. We said okay. We walked into an entire second surprise funeral, and that was only one of the top 5 worst things she ever did to me. Story 20. I work in a state mental hospital. It's been my experience that any of them are horrible. Kind of depends on the severity, but as far as damage done, cluster B personality disorders can absolutely destroy people. Not just the people that suffer from them, but their families, anyone close to them. Borderline and narcissistic PD destroy anyone close to them. And personality disorders cannot be treated with meds. So while something like schizophrenia is a horrible condition, generally it can be controlled. The personality disorders take long and extensive therapy that most aren't willing to do. Story 21. Second year med student. Had some of the scariest ones of my education a few exams ago. Here's the highlights. Really try to empathize with what it would be like to go through these. None of the diseases you are about to read have a cure. Frontotemporal dementia. Your frontal and temporal lobe degenerate, causing you to be functionally drunk at all times, slowly getting worse over a year or two before you succumb. In those 2 short years, you will destroy all relationships while you lose your mind, your family, your kids, your soulmate. You will treat them so horribly that they won't be able to put up with what you have become. And while your judgment deteriorates and you commit more and more unforgivable acts against those closest to you, the frontal lobe degeneration will prevent you from understanding why they stop coming around. The chances of you dying alone are higher than the other way around. Frontotemporal dementia isn't satisfied killing its victim. It needs to kill their legacy. It needs to tarnish your memory in the eyes of those closest to you. Frontotemporal dementia is as close to evil as I have encountered in my education today. Story 22. From onset, you got between 6 months and 1 year. Your brain will rapidly deteriorate as you experience worse and worse dementia. You will forget your loved ones. Your grandchildren become indistinguishable from the memory of your children. No matter your mental strength, your grip on reality will eventually slip out of reach. If your mind wasn't enough, the prion will also take your muscles. Jakob prefers the spastic flavor of paralysis, but will happily settle for a rigid paralysis if he must. As the dementia worsens, expect the creeping intrusion of multiple psych disorders. Sleep is the probably next to go, good restful sleep that is. Then comes the agitation, irritability, and depression. Soon the whispers of Jakob will consume your thoughts as the psychosis and confusion take turns with your sanity. While you live through the nightmare of half a dozen mental disorders, with a dementia-ridden brain functioning at half capacity, your vision will fade to nothing, blind in Jacob's eternal night. Luckily, you're not actually in hell, and your body will eventually stop fighting. This will allow an opportunistic bug like strep pneumonia to cause a fluid buildup in your lungs that will drown you. At least that's the most likely way you to go, statistically. Jakob doesn't even have the decency to put you out of the misery. It prefers to watch others finish the job through the permanent darkness in the depths of insanity. This can happen to anyone at any time, and we still have no idea how the vast majority of cases occur. The only safe places are the frozen poles. Creutzfeldt Jakob lurks on every inhabited continent of this planet. 1 in a million will have their fates intertwined with Jakob this year. Story 23. I can only talk about what I've seen in my experience working at a college counseling center. So, not the worst condition in the world, just nasty ones I dread working with, and are beyond the scope of care we can provide. It'd have to be eating disorders. A colleague consulted about a student with severe anorexia who is still in heavy denial about their condition. They have super low body weight, won't engage with our treatment, nor seek the care they seriously need off campus. They still exercise a ton to drive their body weight down further. They only came to us because their athletic coach won't let them participate, so they wanted us to clear them to play. I feel a lot of helplessness. We only have the capacity to do brief therapy at our center. EDs are beyond that scope of care, especially the one that requires long-term intensive care, close monitoring by medical professionals and dietitians, especially when their insight and motivation to seek treatment is super low. The idea of them suffering through the day on campus makes me so worried and sad. Story 24. Any condition with serious delusion is terrifying. A lot of them have been named here, though I can't really pin any as the worst. Even mild dissociation can be quite frightening. So, as delusions become more severe, it can get so dangerous and terrifying for all involved. If I had to pick one that I think would be the worst for me personally, probably capgras, since I already have some intense anxiety about losing people. And the concept of capgras is both constantly feeling like you can't find people you care about while also being around who you think are total strangers. The roughest part about any delusional condition as well is they are so hard to treat. We don't have a ton of pharmaceutical treatments for them. The therapy itself can only mediate symptoms, not dull them. And often the patients themselves are so lost in the delusion they don't buy into treatment. Story 25. Apologies as this might be inappropriate to the question, and I can't remember the exact name of what I'm describing. I recently heard of a symptom or syndrome wherein the victim has the extreme feeling of needing to crawl out of their own skin all over their body. What struck me about it was that pretty much every person and story I heard about sufferers of this said they either tried or successfully ended their own lives, as they couldn't tolerate the feeling for any length of time. The survivors I recall pretty much universally said they had to be sedated and restrained, or forced to not take their lives and have severe PTSD from the experience. The thing that got me is the acuteness of it. Other things can be a slow and horrible decline into death, but something that can make anybody want to die instead of living through it. And it's all in the mind. There was specifically no somatic presentation, is terrifying to me. If anyone can point towards the name of the symptom and disease, do please let me know. Story 26. Bipolar schizoaffective. Even worse when you've already had kids by the time you have your first break. I'm terrified my children are time bombs waiting to have their lives similarly destroyed as mine. On top of the guilt, I'm scared my condition affects my ability to effectively parent with kindness and compassion consistently. It's hell to live second guessing literally every interaction, to hope that whatever you did was normal. I'm also 100% convinced some elements of mental illness are exasperated by how your parents raised you. I lived my whole life terrified of my mom, who would just fly off the handle about the tiniest of things. Example, family playing Monopoly on Thanksgiving. She realizes she's going to lose, and she flips the board. She had the mental faculties of a 9-year-old, so I never felt safe communicating with my parents about anything, and it forced all my dialogue internally. I'm fairly certain that's where my anxious thoughts and PTSD started, and I think the brain changes based on thought pattern. Yes, genetics play a role, but I think those are odds, and they get further stacked for or against you based on how you were and weren't nurtured.